Bismillahirrahmanirrahim. Today we will discuss MCQs on the reactive arthritis. A 25-year-old male returned from a holiday in Spain 4 weeks ago. Presented to your clinic with knee joint pain, dysuria and redness and pain in the eye. So this patient has arthritis, urethritis and conjunctivitis. So this triad is for the reactive arthritis, conjunctivitis, urethritis and arthritis. That is, knee joint pain is for the arthritis component, dysuria is for the urethritis, and redness and pain in the eye is for the conjunctivitis. So the best option here is the option E, reactive arthritis. Triad of arthritis, that is knee joint pain, dysuria, urethritis and redness and pain in the eye, that is conjunctivitis. So this triad is for the reactive arthritis. So the best option here is option E. Question number 2. Most common organism responsible for the sexually acquired reactive arthritis. Option A, Salmonella. Option B, Shigella. Option C, Yersinia. Option D, Campylobacter. And option E, Chlamydia trachomatis. So we know that reactive arthritis develop from two types of infection, that is the urethritis and from the post-diarrheal illness. Reactive arthritis develop from two types of infection, that is urethritis and post-infective diarrhea. The organism which is responsible for the urethritis, which is also called the sexually acquired reactive arthritis, is the chlamydia. While the organism which is responsible for the post-infective diarrhea, reactive arthritis are the Salmonella, Shigella, Yersinia and Campylobacter. So option A, option B, option C and option D is for the post-infective diarrhea, while chlamydia is for the sexually acquired reactive arthritis. So option E is the correct answer. Question number 3. A 24-year-old woman present with 3 days history of dysuria and painful left knee. During the review of systemic review, she mentioned a bouts of diarrhea and crampy abdominal pain 3 weeks ago. On examination, the left knee is swollen and hard to touch. What is the most likely diagnosis? So this patient has dysuria, means this patient has urethritis, and this patient is also having the painful knee, that is the arthritis, but she also had a history of diarrhea 3 weeks ago, and on examination the left knee is swollen and hard to touch. So what is the most likely diagnosis? Option A, reactive arthritis secondary to Salmonella, reactive arthritis secondary to chlamydia. What do you think? It is reactive arthritis from post-diarrheal illness. So the organism which is responsible for the reactive arthritis after Diarrhea, it is the Salmonella. The second is the Shigella. Third is the Campylobacter and Yersinia. So option A is the correct answer. It is the reactive arthritis from the diarrheal illness, that is Salmonella. Option number 4. Question number 4. HLA-B27 is positive in reactive arthritis. So HLA-B27 is positive in reactive arthritis in 50 to 80% of the patient. So option D is the correct answer. Question number 5. The most common extra-articular eye manifestation of reactive arthritis. The most common extra-articular eye manifestation of reactive arthritis is the conjunctivitis. So option A is the correct answer. Question number 6. A 28-year-old male returned from Spain 4 weeks ago, now presented with pain and swelling in the knee joint, dysuria and red eye. He also has a waxy brown papule on palm and sole. What is this waxy brown papule? So this patient has urethritis, arthritis and conjunctivitis. But this patient here has waxy brown papule on palm and sole. So the question is asking what is the name of this waxy brown papule. So this patient has reactive arthritis. And the waxy brown papule on the palm and sole is called the. So this waxy brown papule is called the keratoderma benorrhagica. The skin manifestation of reactive arthritis are two. That is keratoderma benorrhagica. Keratoderma benorrhagica. And the second is cercinate balanitis. Cercinate balanitis, which is painless papule on the coronal margin of prepuce and the glans penis. So the option E is the correct answer. Question number 7. A 28-year-old female present with knee joint pain and swelling and redness of the eye. She also has a waxy brown rash on her sole and palm. She also complains of pain while passing urination. Joint fluid is aspirated and sent to the lab. What organism you will suspect in this joint fluid? So this patient has reactive arthritis, that is urethritis, conjunctivitis and arthritis. But the fluid is taken from the joint and the fluid is sent to the lab. This question is asking that what organism or crystal will be found in the joint fluid. So we know that reactive arthritis is an inflammatory arthritis and not an infective arthritis. And reactive arthritis can also be defined as it is a type of arthritis in which the organism cannot be recovered from the joint fluid. So there will be no organism in the joint fluid. So option E is the correct answer. No organism will be there in the joint fluid. Question number 8. What is the first line treatment for the reactive arthritis? The first line treatment for the reactive arthritis is the NSAID. NSAID is the first line treatment. If the symptoms are not improved with the NSAID, you can try the sulfasalazine or methotrexate. Methotrexate or sulfasalazine. And if the symptoms are not improving with the methotrexate or sulfasalazine, then you can start the anti-TNF, that is etanercept. So the first line treatment is the NSAID. So option 5 is the correct answer. Question number 9. Each of the following is seen in reactive arthritis except, that is urethritis. Yes, it can be seen. Keratoderma plenuregica, yes, this can occur on the palm and sole. Option C, conjunctivitis, yes, this is present in reactive arthritis. Sarsenet bilinitis, yes, it can also occur in reactive arthritis, that is painless papule on the coronal margin of prepuce. Option E, aseptic meningoencephalitis. No, this is not occurring in the reactive arthritis. Means this is not a feature of the reactive arthritis, but actually this is a feature of the Behçet disease. So here option E is the correct answer. This is not occurring in the reactive arthritis, but actually this occur in the Behçet disease. Thanks.